Good evening, everyone. I'm Tony Segreto, and once again, honored to be your moderator for tonight's In the Know Town Hall. We welcome all of you. Tonight, we're going to discuss a topic of utmost importance, the behavioral health of children. We're at a point right now when our children's mental and behavioral development is a growing public health concern, underscored by troubling data and trends. In fact, some of that data tells us right now that 1 in 6 US children between the ages of 6 and 17 years old has a treatable mental health condition such as depression, anxiety, or attention deficit hyperactivity disorder. But nearly half of these children, half of them, don't get the medical intervention that they need. Neurodevelopmental disorders from autism to ADHD are also on the rise. Developmental disabilities among our children increased from less than 6% back in 1997 to 7% now, according to the latest numbers from the CDC and prevention. And speaking of autism, 1 in 44 children in this country is diagnosed with autism spectrum disorder. Now, you can only imagine, and I mean only imagine, based on different health access limitations, not all children are getting the medical care that they need to grow into healthy, productive adults. So here's the question. It's a big one. How are healthcare providers dealing with these disturbing trends? Well, tonight, how fortunate are we? Because we have put together an incredible panel to discuss this pressing topic, as well as the latest treatments proving effective for children battling all of these different disorders. You're going to hear from renowned UHealth and Miller School experts in the field of child behavioral health. The panel is led by Dr. Glenn Flores, the chair of the Department of Pediatrics, Senior Associate Dean of Child Health, and Professor of Pediatrics and Public Health Service at the Miller School of Medicine. He's going to be joined by Dr. Daniel Armstrong, Executive Vice Chair of the Department of Pediatrics. He's also a professor in that department, and he's also the director of the Mailman Center for Child Development and interim director of the Pediatric Pulmonary Medicine Division at the Miller School. Also joining the panel is Dr. Jeffrey Brosco, Associate Chair of the Department of Pediatrics, Professor of Population Health, and Associate Director of the Mailman Center for Child Development. He's also the Director of the Population Health Ethics at the Institute of Bioethics and Health Policy at the Miller School. Also with us tonight, Dr. Alan Delamater, Professor in the Department of Pediatrics and Psychology and Director of Clinical Psychology at the Mailman Center for Child Development, Miller School of Medicine. And Dr. Elizabeth Polgarone, Associate Professor of Clinical Pediatrics in the Department of Pediatrics. Dr. Polgarone is also the Director of Mental Health Services for the Dr. John T. McDonald Foundation School Health Initiative of the Miller School of Medicine. How any of these doctors sleep or find time for themselves to sleep is beyond me. We may have to ask them that question tonight among all the others that we have. But as you can see, this is truly a world-class group of experts. Now, before we get started, let's go over how you can participate in tonight's conversation. After Dr. Flores has delivered his opening remarks, all the panelists will answer the questions that you've submitted over the last few days, and there have been a number of them, so stand by. You're also going to have the opportunity, though, to submit your questions during this program. Now, for those of you who have been with us before, you know the drill. For those of you who are new, at the bottom of your screen, you see a Q&A portion there. That's where you send us your questions. All the questions submitted are anonymous, and we deeply promise that we're going to get to as many questions as you submit to us. But in order to do that, we have to get this program underway. So now it is my distinct pleasure to introduce Dr. Glenn Flores. And Dr. Flores, we are so honored that you and your team could be with us tonight. I know how busy you all are, and it's going to be an exciting evening for a lot of people.
Well, good evening, and thanks again, Tony, for that lovely introduction. I'm delighted to join you all tonight. I'm equally honored to speak on behalf of our extraordinary faculty, physicians, and staff in the Department of Pediatrics at the Miller School. It's a distinct privilege for my colleagues and me to share with you tonight our expertise, experience, and research. We're caring for children suffering right now from soaring rates of depression, anxiety, trauma, loneliness, and suicidality that will have lasting impacts on them, their families, and their communities. That is why the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association recently joined together to declare a national state of emergency in children's mental health. I'm sure we will have many opportunities tonight to discuss how this public mental health crisis for children has fundamentally changed our health system and the care and research available to children. But let's start with some key facts. Up to 1 in 5 children experiences a mental disorder. Indeed, for the first time in 50 years, the top 5 chronic conditions are all mental rather than physical disorders. Half of all mental and substance use disorders start by 14 years old, and suicide is the leading cause of death among 12 to 17-year-olds. But there is hope. Our mission in the Department of Pediatrics is to accomplish extraordinary things every day for children of all ages. Our vision in the Department of Pediatrics and the Mailman Center for Child Development is to advance pediatric care, research, education, and advocacy. The Mailman Center is one of the top 10 programs in the United States for children with neurodevelopmental disabilities and chronic illness. Our teams are defining the future of pediatrics. As we answer your questions, we will share more on the important child behavioral health care and research issues at the Miller School of Medicine that has global implications. We will also explore prevention, innovative interventions and therapies, and exciting behavioral health programs that are bringing much needed hope to families. We can answer a wide range of questions, from the developmental impact of medical conditions like cancer or diabetes on a child's behavioral health, to the long-term impact and treatment of disorders such as ADHD, autism spectrum disorder, and dyslexia. Each one of our panelists brings special and impressive expertise. Dr. Armstrong's primary focus is on neurocognitive impairment in children with a special interest in innovative assistive technology to improve access to care. Dr. Brosco will help us understand child behavioral health policy implications and population-based interventions that improve the health of communities. Dr. DeLamere's clinical work with children's, adolescents, and their families will shed light on the children's mental health and child development. Dr. Polgaron will help us explore mental health outreach and access in underserved communities to address the critical developmental needs of children. While answering your questions, we will share the latest innovations in child behavioral health research and the implications for the communities that we serve. Our goal tonight is to answer your most pressing questions about the causes, prevention, and treatment of children's developmental and behavioral health. And by doing so, to empower you and your child. We look forward to answering your questions. Tony?
Dr. Flores, thank you. Some staggering and very sobering numbers. Well, that leads us to our first question. And Dr. DeLamere, you're up first. We welcome you. The question is, in fact, it's a two-part question. What are the most common behavioral health problems, and at what ages do they typically occur? Welcome, Doctor.
Thank you very much. It's really great that we're focusing on this topic tonight. I'm really happy to be here to talk with you all. Let's talk about this term first, behavioral health. It's really referring to the connections between behaviors and our overall well-being, and includes behaviors such as what we eat, our physical activity, how we sleep, substances we take. All of these behaviors have an impact on our physical health, but also on our mental health. Behavioral health encompasses mental health as well, which is our emotional, behavioral, and mental well-being. So we think about those behaviors that or what the most common behavioral health disorder is. I would have to say it's obesity, because if you think about those behaviors that impact on that condition, they include things like the intake of sweetened beverages, the lack of appropriate diets in terms of fruits and vegetables, and the lack of physical activity. So kids are not meeting the guidelines that are set, and therefore rates of obesity have skyrocketed. So more than 35%, almost 40% of kids are overweight or obese, about 20%, or overweight, about 20% are obese. So that, I would say, is a major behavioral health condition. In terms of mental health issues, though, the most common in childhood, and we've already heard from Dr. Flores, ADHD, anxiety, both around 8 to 9% of the population. Behavior problems like oppositional defiant disorder, conduct problems around the same percentage, and depression, 5 to 10% of the population. But in adolescence, those rates are a little bit higher. So we see more adolescent depression around the 15% range, with many of them exhibiting suicidality. And we also see high rates of anxiety. These tend to co-occur. So kids who are anxious may also be depressed. We also see substance use in teenagers, as well as eating disorders. So all of these are major problems, I think, in terms of behavioral health and mental health specifically.
Thank you, Doctor. Dr. Armstrong, we welcome you. And this next question, two of them really belong to you. What are the first signs to find out if a child has a mental disorder? And the second part is, does it usually come along with a primary or secondary condition? Dr. Armstrong, welcome.
Thank you, Tony, and thanks everyone for joining us tonight. And the question is a really interesting one and a little bit complex. When we think about mental and behavioral health challenges in children, there are some that we can link very clearly to the biology, to the way that the brain develops, to the presence of certain biochemical processes in the brain. And some are things that actually develop over a period of time because the brain goes in a different direction. And those are really some of the organic type causes of really significant behavioral and mental health problems. And then there are another group where the issue is a child may be at risk, but we can't really assign most of the blame to their biology. It comes because of stress and coping, environmental factors, learning issues, things that are going on in the environment. And when we think about what are those first signs, it's really pretty important to think about which of these processes that are going on, and also to think about how old is the child. So when we have, if there are some keys for us that we would raise, as Dr. Delamater mentioned, anxiety, depression are two of the big issues that we're concerned about. Those are going to show themselves in different ways at different ages. In the child who is under 3 or 4, they may not be able to verbalize how they're feeling or to share exactly what they're doing, but you'll see it in other kinds of behavior, like disturbances in their sleep. They may not be eating as well. We'll see a withdrawal from social interaction and play that's different from the way that they typically respond. And we've seen that and heard it reported a lot during COVID. As children have been isolated, they play off the stress of their families, their parents, and the like. As children get older, they become more and more capable of verbalizing how they're feeling, and that's where we'll start to hear, particularly in the school-age children, more likely to say things about how they're feeling, what they're afraid of, what they're sad about. The concern that we get into is really in the adolescent areas. Dr. Delamater mentioned the suicide issue, where we're talking about a child taking their own life, is of real concern. And those are hard to tease out because adolescents are adolescents, and you have to ask the question, is this a high risk issue, or is this just my kid going through a phase? The important thing is to really ask about it, to keep an open set of communication, because what may be happening is the child becomes isolated from their peers. There may be bullying going on. They may experience some loss in areas that we don't know. Think about, I had my first girlfriend and she broke up with me. Well, that might be a transient kind of thing, but for some children, it can be very much more significant. So the crucial answer to the question is to talk to your child, to observe their behavior and to look for things that are different from the way that they normally are. Those are probably the first indicators, but not to jump immediately to the concern that my child has a major mental health problem. The best thing is to identify these signs and symptoms early and intervene to prevent right off the bat.
Thank you, Dr. Armstrong. Dr. Flores, are there disparities to be aware of for racial, ethnic minority children with behavioral health conditions?
Yeah, sadly, there are multiple disparities for many racial and ethnic minority children, and just a couple of noteworthy ones. So for African-American children, We know that there are disparities in terms of them being much more at risk for underdiagnosis, undertreatment, lower adjusted odds of evaluation, receiving a diagnosis and receiving medication or treatment, higher proportions of parents with negative expectations about the treatment helpfulness. And then when you look at autism disparities, there is famous work that documented that African-American children receive their diagnosis of autism 1.4 years later on average than white children. And they are in mental health treatment a mean of 13 months longer than white children before receiving an autism diagnosis. And in terms of Latino children, just a couple of the many disparities that have been documented, we know that they have a significantly higher unmet need for mental health care, and they have lower odds of any mental health visit, outpatient visits, antidepressant prescriptions, and receiving treatment from a mental health specialist for any condition, behavior problems, or depression.
Thank you, Dr. Flores. Again, these numbers just kind of make you shake your head. Dr. Polgaron, we welcome you this evening. This question is for you. Is there any treatment or help for social anxiety or social executive functioning skills?
Definitely, there are a lot of treatments for anxiety. And as my colleagues have mentioned, one of the most common disorders that we see, not only among children, but in adults, it just tends to present a little bit differently in children. And since COVID, if we think, so many of us have experienced anxiety in some way or another. I often tell families, our children are learning to interact with each other through school, through those talks with the neighbors, through family gatherings. And since the pandemic, we've really restricted their ability to naturally develop these skills. So this question specific to social anxiety is not surprising at all. The good news is that yes, we have excellent treatments available. They can be a little tricky, I will be honest, especially to do on your own. So for example, exposure is often used when it really is a case of social anxiety. That can be challenging to do and to motivate our children or ourselves that are struggling with that. We definitely would recommend getting some professional help for that. But even just generally, there are a lot of podcasts and self-help books and different things that you can start off with. If you really are concerned that your child is struggling with anxiety, I would seek professional help. We have excellent programs here at the university, as well as others that can assist. And you will get a lot of relief if we can figure that out. And something that if it's treated in childhood will not continue to escalate, but if left untreated, can make it very difficult in adulthood.
Thank you, Dr. Polgaron. Dr. Brasco, we welcome you. How has the pandemic, and Dr. Armstrong touched on this, how has the pandemic affected the behavioral and mental health of children and adolescents?
Oh, thanks, Tony. Well, it's affected all of us, right? I mean, all of us probably in slightly different ways, but whether you're feeling anxious or sad or just overwhelmed, it's pretty common during the last couple of years. It's just been a hard couple of years. And for school-aged children, as you've heard from some of my colleagues, not being able to interact with their peers, not being able to do the sorts of routine things they do, has certainly been harder on them. And in our younger children, especially their learning, they really need to be there in person. So it's been hard for them as well. And if you look at some of the statistics across the state of Florida, the number of school-aged children who report feeling so depressed or hopeless for 2 weeks that they weren't sure what to do about it went from about 25% up to about 35% for the last couple of years. So we see it in Florida, not just sort of in the national statistics. I also want to add too, though, that this has been an opportunity for resilience in finding new strength in families. And even as I hear families talk about how hard this has been, if I ask them, what's one good thing about the last couple of years? They'll often say, well, I had a chance to have lunch with my kid a lot more often, or we came together closer as a family at sometimes. So I think, in the midst of all the hard stuff we've been going through the last couple of years, there's also these opportunities to find strength in our families and in our interactions. So I want to make sure we don't lose track of that either.
Dr. Brasco, thank you. I think that's the key word, resilience of family. I think that's a great point. Dr. Delameter, back to you. With COVID and being at home and so much stress, my child seems to be worried a lot more than she should. What can I do to help her?
Well, you won't be surprised to hear me say the very first thing that parents should do is talk with their children, not to them or at them, but really listen to their concerns, validate the concerns that they have. And this gives us an opportunity as parents to really provide accurate information about what's happening in the community and what's happening with COVID. It provides us an opportunity to reassure our children that they can be safe. I think one of the most important things is for parents to emphasize that we do have some psychological control over things that happen to us in our lives. And in particular, we can engage in behaviors that mitigate risk. So including, the social distancing and the masking and vaccinations that we're all really well aware of are important components of treating this pandemic. But more importantly, I think that parents can be a good role model for their kids about these behaviors, about really kind of showing kids that we can be resilient, as Dr. Brosko was saying. We can be creative in dealing with the new situations that COVID has presented us. The fact that we're into the third year of this does not mean that there's any less of an impact. In ways, kids are still suffering from this and are still fearful. And so, it's a continuing issue. Finally, I would just say that emphasizing normalcy, the normal family routines and rituals and structures, keeping things healthy in terms of all of those good family habits that we know promote optimal child development, having meals together, having consistent wake time and sleep time, getting good nutrition, and being physically active outdoors as much as possible. All of these are important factors. The most important thing is let's talk with our kids and listen to them.
Dr. Delamere, thank you. The two simple words, right? Talking to or talking with, and talking with is critical. Dr. Armstrong, we're welcoming you back. Why is it so difficult to see a psychologist or a psychiatrist or another mental health provider? What are the barriers to receiving behavioral health services?
Well, Tony, the first barrier is availability. I had the chance in 1999 to work with David Satcher when he was Surgeon General of the U.S. on the Surgeon General's report on child mental health. And one of the things that struck me in the work that we did was a figure that if at that time you took every child who met the criteria for the diagnosis of a behavioral or mental health disorder, and then you took all of the child and adolescent psychiatrists, psychologists of all types, social workers, nurses who with training in child mental health, and you looked at that, the caseload for every professional was 900. That's an unmanageable number right off the bat. That hasn't changed since 1999. In fact, it has gotten a lot worse. We've just completed some work in the Florida Association of Children's Hospitals this year, preparing Florida to be able to address child mental health in a very much more aggressive manner. The estimations in Florida right now is that there is one child and adolescent psychiatrist for every 10,000 children who need them. The number of 1 in 900, when we take all of those numbers for the state of Florida, has now gone up to about 1 in 1,500. One professional for every 1,500. During COVID, the underbelly of this problem really showed itself. And our children's hospitals, the 15 children's hospitals in the state, we took a look at them. The wait time for a first appointment is between 5 and 6 months at every children's hospital in the state. And many of the hospitals in parts of the state had to convert their medical beds to inpatient psychiatric beds in order to meet the needs. And they had difficulty being able to find follow-up care upon discharge from an acute inpatient admission. So the numbers are really staggering, and that there just aren't enough people out there. And it's going to take us a number of years to be able to correct that problem. There are a whole host of reasons for that. Our payment systems, for many, many years under managed care, there was a carve out where mental and behavioral health were treated differently from physical medical health. And that created barriers for access. Part of this is that we're going to have to really be able to think about ways to innovatively open up access. For all of the issues of Zoom and telehealth that people have complained about, it has been a major benefactor to being able to provide access to care, particularly for children who live in an area where there is no mental health provider for 50 miles. We've been able to do services there. At the Mailman Center, we have a team of folks who are working on evidence-based work, a great program called Parent-Child Interaction Therapy, or PCIT, and they are evolving that to tease out a program that they're calling Pocket PCIT, which is accessible on the web for the less severe kinds of difficulties that are coming up. So parents can go through and do a self-guided approach with their child without having to actually see a therapist, and then be able to raise that to group work using the internet, ultimately leading us to a smaller group at the top with more significant problems for direct one-on-one work with a professional. So our challenges go back decades. The COVID has just really explored the possibility. So innovation in care is going to be an essential part of getting us out of this. And that's one of the things we're really working hard on at the Mailman Center right now.
And Dr. Armstrong, thank you. Those numbers just sort of make your head spin, especially the 900 that's still the same. It's just, it's remarkable. Dr. Brasco, we're going to bring you back. The question goes, I have never sought out behavioral health services for my child. Where can I start?
So a good place to start is with your pediatrician or family doctor or nurse practitioner. So most families are connected into their primary care. That's always a good place to start because they can help you get a sense of whether something requires a more in-depth mental health professional or just some reassurance. And one of the ways we often talk about this, it's kind of a funny thing called the big three, little three that some of us talk to our residents about. And the big three are how a child's learning, how a child's getting along with his peers, and how that child's doing the usual thing like following the rules, getting along with the grownups. And the little three are eating, sleeping, and toileting. And when a child's doing fine with all of those, but maybe is a little bit anxious or sometimes doesn't listen to their parent, but otherwise is functioning pretty well, that's pretty reassuring. And it may be that your primary care physician or nurse practitioner can talk about some simple routines and see how things go and follow up closely. But when it's affecting how a child's learning, how they're getting along with their peers, they're getting in trouble with their teachers and their parents, or as Dr. Armstrong mentioned before, they're not eating well, they're not sleeping right, there are other sorts of things, then it's probably time to bring in someone with more expertise. So I would say if you start with your primary care person, that's probably a great place to start. The other thing is that you certainly can look online. You know, certainly at the Mailman Center, we have ways of helping connect families with their resources. We at the Mailman Center believe that we should be helping community practitioners get really good at what they do. We don't want every kid coming to the Mailman Center. We want to make sure that folks out there also do a good job, but we're a good place to start and we can connect families with resources.
Dr. Brasco, thank you. Dr. Polgarone, this was just sent to us. What does the research show for group therapy for children?
You know, groups are really popular. And I think the research can be a little bit mixed, to be honest. There's a lot of interest in groups, and it can be hard to actualize groups. So getting groups together, I know, has always been a challenge for us at the Mailman Center. Now, if I can piggyback off of what was mentioned just a little bit ago, now we have Zoom. So it really has facilitated this idea of group, look at us all here tonight, in a way much more easily accessible to families and presumably to a lot more families. There still are access issues, we're not going to deny that. But in some ways, at least physically and time and multitasking, it can be definitely an effective modality. I think groups are effective depending on the presenting problem and the severity. There are definitely times where group is enough, and with group you get that support, some basic skills, and you're going to see some change. And then there are times when we need a little bit more than group. So I think it will depend specifically on the question, the diagnosis, the presenting problem, but I love groups. We try and do groups at the schools as much as we can. I think, you know, speaking of providers and facilitators, we can really train providers that might not necessarily have to have this very high specialist degree to be able to conduct groups. And kids and adolescents they like group. They like talking to each other. They want to connect with others that have similar sort of presenting problems or issues, or just kind of vent outside of their traditional parents or teacher kind of setting. So I think there is promise and potential for group. Is it the only and always answer? No, I wouldn't say that, but definitely a possibility.
Dr. Polgaron, thank you. You know, when you were talking about the group therapy, all the doctors, I'm watching in the full screen here, every doctor, Dr. Brasco, Dr. Armstrong, Dr. Delamater, Dr. Flores, they're all nodding their head. They're all nodding their head, yes. And Dr. Flores, we're going to come back to you. If my child is getting medication for his or her behavioral health issue, does he or she also need to see a therapist? And how would that benefit them?
Yeah, so Tony, thank you for that question, because I think it's critical to understand that medication alone rarely is going to be the solution for a behavioral health issue in a child. For example, with ADHD, we know from lots of studies that the medication alone won't do the job well, that you need to make sure, for example, that if your child is school age, that they either have a school psychologist or a school counselor. And the reason is that they can help them with the behavioral components of ADHD. So how to manage the impulsivity, how to manage the attention deficit that they have, and how to approach their hyperactivity. Another field where you see lots and lots of studies definitely documenting that you want to have therapy together, you want to have a therapist together with your medication, is with depression. And in fact, there's some studies that show that therapy, a therapist alone can be as effective as the medication, but when you combine them, there's this synergy that you can't get with either one alone. And so again, it's really critical not just to stop and say, okay, the medication is there, we're taking care of the problem, because there's a lot more to behavioral health for children.
Thank you, Dr. Flores. Dr. Polgaron, we're coming back to you. What if you suggest, and then continue to suggest, that a 19-year-old boy speaks to a psychologist, but that 19-year-old boy refuses to and says it won't help? How do you persuade him?
Well, I might ask how you get a 19-year-old boy to do anything, first of all. But all kidding aside, adolescence is challenging, right? Let's be honest, especially as a parent. And if I assume that this is a mother telling a 19-year-old boy that he needs to go see a therapist, that might be even more of a challenging conversation. So I might start with a different messenger, right? So maybe that's a teacher, maybe that's a neighbor, maybe that's a cousin. So sometimes the messenger can really make a difference in seeking help. The other thing I would consider is that it can be intimidating to try and seek help, and we have to acknowledge that. So that refusal, that avoidance is often reinforcing. I might start a little bit smaller. So psychologists can be a little bit intimidating. So maybe a counselor, a coach, a pastor, another trusted individual. There's different types of mental health treatment that don't necessarily have to start at the psychologist level. Of course, some conditions might require that, but if you can get started, I would rather take that than this refusal to have more professional help. And then I think the larger question really here is, despite the fact that we are becoming more and more aware of this mental health crisis that we are in, there is still a lot of stigma associated with getting mental health treatment. And to me, that's the larger issue. Yes, it can be challenging to get our adolescents to come to therapy, to agree to see a psychologist, especially for the first time. But I think that really is the larger issue of that hesitancy, our assumptions about laying on a couch and someone meddling with my brain can be very intimidating to many of us. So I think slowly but surely we're working through that, using different messengers, starting off small and little by little, but I wouldn't give up.
Great advice. And I think we're well beyond the couch days, right, Doctor?
I don't have a couch, I'm going to be honest. I don't have a couch in my office, but we do good work despite the couch.
Thank you,
Tony,
Doctor.
can I add a couple things to what Dr. Polgaron just said? I mean,
Please
I
do.
agree entirely with Lizzie and what she said. Just two other things to consider. One is that sometimes, because this happens all the time in my practice, the child won't go, but parents can do a huge amount. Other family members can. So sometimes I'll recommend that even they start talking to a psychologist or a therapist, because how that parent interacts with their child can have a big effect of how things go. And as kind of a last ditch effort, there's some interesting research now about kind of do-it-yourself approaches for online stuff. These sort of single session interventions for anxiety and other things. So that's one other thing. I agree with Dr. Polgaron, much better off with a live person interacting. But if you really are stuck, there are some online things that can be pretty effective.
Tony,
Excellent.
can I follow that up as well?
Absolutely.
We're
Please.
having a nice conversation. I think part of this is all, and this goes back to Dr. Flores's comments on the medication as well, is a reframing of therapy. I mean, when you mention to someone that we're recommending you go see a therapist, there is this concept of a couch or someone who is going to read your mind. I'll tell you, I have a PhD in psychology. I've got board certification, 2 areas. I can't read minds. And so reframing this to something that we really now understand more in terms of our evidence-based intervention is that a lot of what we're doing is teaching new skills, helping to develop new skills. So when we think about ADHD, we have a friend across town at FIU, Bill Pelham, who led the major research looking at the combination of medications for ADHD, comparing that to social intervention, social skills training, and then looking at the combination. And it was the medication helped to deal with the neurobehavioral component of the issue, but the social skills training was the thing that helped to change the behavior, the way of viewing, the interacting with the peers. The major trials, you're looking at treatment of depression over the last number of years, the behavioral component fits into cognitive behavior therapy. And it's teaching people how to reframe the way that they look at messages coming in, to look at how they talk about things, to look at the frequency that they used positive statements over negative statements, a skill training component. And so sometimes with that 19-year-old, instead of saying therapy, to be able to come in and say, I know you're having some difficulty dealing with this. There are some specific skills that I can help you learn to help you be in charge of handling this problem. And that reframe can also often be a really big shift with that 19-year-old.
That's amazing advice. Dr. Flores or Dr. Delameter, would you like to add anything to any of this? All right, Dr. Delameter, we do have a question for you. There seem to be so many different professionals dealing with behavioral and mental health, from psychologists and social workers to psychiatrists, marriage and family therapists. What are the differences between all of them?
Yeah, I think it's an important question, and there's often confusion and a tendency to lump all mental health professionals together as therapists. But there's actually a lot of differences among the different types of mental health professionals. So if we talk about a psychiatrist, for example, they're medical doctors who actually go on for residency in psychiatry, and with children have specialty fellowship training in child and adolescent psychiatry. So that's like, a lot of years of training. Psychologists are doctoral trained professionals. So that means they have a degree like a PhD or a PsyD, Doctor of Psychology, or an EDD, a Doctor of Education. But that typically requires 5 to 6 years after college of advanced training and internship and supervision and supervised clinical work. Then there are master's level therapists and professionals. So we have the social workers and licensed clinical social workers who can do more than just kind of hook families together to get resources. They can also do therapy and help address these problems that we're talking about today. And then there are other master's level trained therapists, mental health professionals that include marriage and family therapists, as you mentioned, as well as mental health counselors. Then there are school psychologists. School psychologists can be trained at the doctoral level, but many of them are trained at what we call have a specialist degree, sort of midway between a master's degree and a doctoral degree. There's plenty of people who may call themselves counselors. There's counseling psychologists who are also can be licensed as psychologists because they're also trained in doctoral training. So there's a lot of differences among them in terms of the background, the orientation, the number of years of training, but everyone has a role. And when we think about the issue raised earlier about access and capacity, everybody's important. All the different professionals are important to address the need. And it turns out there's more of the more of the master's level clinicians than there are of the doctoral, and there's even fewer of the psychiatrists. We do have a national shortage, as Dr. Armstrong pointed out, in the entire behavioral health, mental health workforce.
Thank you, Doctor. Dr. Brosco, what Florida resources are available for parents of children on the autism spectrum?
Well, there are a number of resources available in Florida, and probably the most important one are the CARD centers, the Center for Autism-Related Disorders. So there's one at Nova, there's one at actually each of the universities across the state. And you can just go to the website and say CARD Florida. Just be careful that you get one of the universities because there's an ABA company, it's slightly different. And these centers are funded by the state of Florida to provide information to families. They have fathers groups, they have summer camps, they have a whole range of things. And their clinicians, because there are so many children with autism, it's about 6,000 people in South Florida that are in their sort of data set. They hear from families what works, what school is going well, what therapists, where to go for a haircut. I mean, all the kinds of routine things that families have. So it's a really wonderful resource. Autism Speaks, the local chapter, also has lots of information for families. They have a document called the First 100 Days that we routinely use with families to help them. What do you do when you get a diagnosis? What are the things you do? Parent to Parent and Family Network on Disability are two other more general groups that also have, they're created by families for families. And sometimes, all of us on this panel, we kind of know how the law is supposed to work. We know how the schools are supposed to do. But it's families that have actually been through it and say, you can't go on Tuesday because then Joe's there. You got to go on Thursday because Alice, she's the one who will really help you out. And that kind of real information you can get from CARD, from Family Network and Disability, Parent to Parent. Those would be my top options. Now, of course, professionals, we have lots of information too. And Mailman Center for Child Development, we see kids with autism all the time. And so those are the places that I would start.
Doctor, can I keep you here? The audience is asking, can you please repeat the DADS group one more time so they can take it down?
Sure. So I was giving that as an example. So the various CARD centers across the state. So there's Nova CARD, FAU has one, the University of Florida has one, University of South Florida has one. But for us, it's the University of Miami CARD, and it's the Center for Autism-Related Disorders. And they have a whole variety of things. They have a summer camp, they have sibling groups, they have clinicians who will meet with a family and kind of go over things and say, how are things going in school? And they can even do visits and sometimes help out the teachers. So they do a wide range of things that support families. And because it's funded through the state and through philanthropy, there should be no cost to families.
Thank you, Doctor. Those programs, by the way, are absolutely fabulous.
Amazing.
Yeah, Dr. Flores, this question came into us. Sometimes my child does something like line up toys. That makes me wonder about whether he has autism. What are the behaviors I should be looking out for?
Tony, if you don't mind, I'm going to turn this over not only to the collective wisdom and experience of my panelists who know a lot more about this than me, but then of course you heard Dr. Brasco is a state and national expert on this. So I'm going to let the panel collectively answer this one because I think you'll see that there are going to be some amazing insights.
That would be great. Dr. Brasco, you want to lead us off on this one?
Sure. So this is a really common question in my practice. And it's amazing to see what's happened in the last 20 years. 20 years ago, very few people talked much about autism. And now families will say, my child's joint attention is not so good. I worry about his social referencing. And it's families that have looked a lot on the internet to see what's happening. A really wonderful resource that I want to start with is the Centers for Disease Control, the CDC, has something called their milestone tracker. And if you just do developmental milestone CDC, and we can share the web link with folks, it is a wonderful wealth of resources. So you can go online and you can click on, my child's 4 years old. What should he be doing at age 4? There's also an app that's a tracker that as your child gets older, you get messages all the time. And it also includes things you can do with your child to help build their developmental skills. So as to the specific question, families often worry about my child, flaps his arms or lines things up. And those are occasionally a sign of autism, but they're usually not and often not. And the thing that we look for most in autism is how well does a child communicate and go back and forth with the people in their world. So if it's a child who's really good at telling you what he's thinking and has a wonderful imagination and knows when you're sad and understands what you're thinking and there's a lot of back and forth, then we tend not to worry so much about things like lining up toys. But if your child's really not communicating very well, doesn't quite understand what's happening in situations, especially social situations, their play isn't very interactive, that's a child we can be much more concerned about. Again, starting with your primary care physician or nurse practitioner is a good place to start as well, because they often can go through those developmental milestones with you. The referral should be quick, right? Because we know the earlier we intervene, the better off the kids do. Our early steps programs for children less than 3 in our public schools for kids 3 and older can do an evaluation and help you understand what's happening with your child.
Anybody else? Any doctors want to weigh in on this?
I would just add that it's not just one behavior that, like lining up toys, that is going to be necessarily a problem, because that may be, quite normal. It's the combination of all these things that Dr. Bosco was just talking about. If there's impairment in social relationships, if there's extreme rigidity, so that if you move one little toy out of place, the kid flips out. Now we're talking about something that may require a more thorough evaluation.
Yeah, and I would add, as a general pediatrician, primary care provider, that your primary care doctor or a nurse practitioner or a physician assistant, they routinely screen for autism. They have a variety of powerful instruments to do this. But obviously, if you're concerned and you see a behavior that concerns you, bring that to the attention of your primary care provider, and then they can help you to identify whether there's a further workup needed or not.
Dr. Armstrong, would you like to add anything?
No, that I think they've covered this incredibly well, and I don't have anything else to add.
And what something else that I'm aware of is that in the past decade, the spectrum has expanded. What we didn't know 10 years ago in terms of autism is now a behavior is on that spectrum where we really didn't identify it that way. Dr. Polgarone, this was just sent to us. What is UHealth doing to support the Hispanic and minority populations in Miami?
That's an excellent question. And obviously the Hispanic community for us is quite large in Miami, and the university is very invested in. And personally, being of Cuban descent, always near and dear to my heart. So I think we do a lot in our community. So sometimes people think of as the Gables campus or the Mailman Center or the medical campus. But to be honest, a lot of our providers are out in the community. Many of our clinics are out in Little Havana. Personally, I'm doing some work in Overtown as well as North Miami. So we are trying to expand and get out into the community. We have a beautiful center now in Doral that is just opening up. So there's a lot of exciting programs outside of our traditional kind of come to the large centers in order to be able to reach those units. I can share specifically, not presently, but in the past, during my time at the university, I've actually worked with our pediatric mobile clinic. So one of our physician colleagues, Dr. Gwen, has done a lot of work with our mobile unit, which works specifically and targets children who do not have insurance, and goes out into all sorts of remote areas from Homestead all the way up through North Miami. And there we really see a lot of Hispanic families and Spanish-speaking families who either just arrived or looking for school physicals, really trying to get some basic health care. And we also actually have mental health providers on that unit as well. It's a mobile unit, a really, really neat program, and just one example of the ways that we're out there trying to help not just our Hispanic families, but really families from all cultures and our community here in Miami-Dade.
Yeah, and if I could add, Tony,
Yes,
at University of Miami Miller School of Medicine, we have a really impressive array of bilingual, culturally competent providers. I think it's the most bilingual set of providers I've ever seen, both pediatric and in psychology. And the other thing is that we're training a future generation that's also bilingual and culturally competent. And in fact, I believe we just came out with the rankings of the most diverse medical schools. And if I recall correctly, we're, I think, number 4 in the nation. So clearly we take the care of Hispanic children very seriously, and the care of diverse communities very seriously.
Thank you, Dr. Flores. Yeah, that's just great information, and letting people know that we are here for you no matter what. Dr. Delamater, this was just sent to us. Are there certain predictors or leading indicators in childhood that may lead to adult conditions, especially if left untreated?
Yes, the answer is yes, completely. And, the two most important of those probably are noncompliance, which begins typically in the preschool age. And if left untreated, that may progress to oppositional defiant disorder. That may progress to conduct problems. So if untreated, noncompliance leads to a host of difficulties in social adjustment later. Another one is anxiety disorders. If they are left untreated, they will predict to anxiety problems that continue into adulthood. And so if you have an anxious kid who doesn't get treatment, in all likelihood, they're going to be an anxious teenager and an anxious adult. And the thing is, as Dr. Polgarone pointed out earlier, we do have very effective treatments for anxiety. So it's just a matter of getting those treatments to the kids that need them. Same thing with noncompliance. We have very effective treatments. We have a strong evidence base for the effectiveness of behavioral interventions for these very common problems.
Dr. Delamater, thank you. And Dr. Armstrong, how do you help a 6 or 7-year-old child with emotional self-dysregulation and other signs of executive function issues when a 2-parent household differs?
Well, we have a tremendous program that is running at the Mailman Center. I mentioned it earlier, parent-child interaction therapy. And it is a training program that focuses on the child's behavior, but helps to teach the parents how to interact with one another. Now, when you get to an issue where the problem is more than just a difference of opinion about how to parent the child, and is part of a larger issue of a family that's separating, a family that has separated, and there's a divorce going on, divorce has occurred, and there's decades of animosity. That's a different kind of issue, and some professional mediation and negotiation becomes very critical in that particular situation.
Thank you, Doctor. And Dr. Delamater, back to you. How do we as parents have the sex talk with children on the spectrum? And how do we address sexuality and sex with them?
Yeah, great question. The bigger question is, how do you talk to any kid about sex, I guess? And, parents are avoiding this discussion. They're anxious about having talks about sex with their children because, it is an anxiety provoking situation to think of your child growing into a person who actually has sexuality and will engage in sexual behavior. So that's kind of a scary prospect for many parents. They may be embarrassed actually to have this big talk. So the whole idea of having a big talk is really kind of a fallacy, I think. I think it's better strategy to begin having little talks and being open about sex. And even with little kids, for example, that begins with having the correct terms for one's anatomy. With kids that are a little bit older, it begins to have a discussion about what's appropriate touching and what's not appropriate touching. So the sense of boundaries that needs to occur. So all along the period of development up until puberty, when it becomes obvious that kids are becoming sexual beings, it's important to be able to address all those issues in an open way and in a way that's natural, because sexuality is part of our being. So kids are going to get information about sex no matter what, right? So we don't want them to necessarily get it from all the wrong sources. And so it does give parents an opportunity to, again, I'm coming back to talk with your children, ask them open-ended questions about, well, tell me about what things you're learning about sex at school, or what questions do you have about sex or about any of these issues. I think that's listening and being able to respond gives us opportunities to provide accurate information. As kids get a little bit older into the teenage years, of course, they're going to have much more exposure to all kinds of things on the internet, for example. And so we have to have discussions with them about exposure and what, to sites on the internet, and monitor what our kids are doing on the internet. I think that's really a key. Of course, the issues of birth control, STDs, and all that should be addressed. And I think that we have the opportunity. Now, with kids on the spectrum, it gets a little bit more interesting, doesn't it? Because they have issues around kind of rules and rigidity and social relationships and being awkward and not knowing how to navigate these. These are very challenging issues around sexuality for normal kids without being on the spectrum. So kids on the spectrum do respond well to structure and to rules. So having a sense of, well, what are the rules around touching myself, masturbating is not appropriate in certain environments. It may be, and we have to teach our kids about these, about the appropriateness and what the boundaries are and what the rules are. And I think that's especially important in the case of kids who may be on the spectrum. And we're seeing, as you noted, way more of this because we're better at looking at this and identifying this. And, there are many kids that are on the spectrum who actually have high intelligence, can have a lot of, insight into things. They have lots of skills, but they need help in sort of navigating social skills, social relationships, and learning how to navigate sexuality creates even more of a challenge.
Tony, can I jump in with a commercial announcement?
Yeah, please do.
Dr. Delamater just hit on the topic. A couple of months ago at the Mailman Center, we had an outstanding grand rounds from someone who works specifically in the area of sexuality and disability. That is archived on our website at mailmancenter.org. It's the easiest way to get into it, along with a whole host of other archive presentations, training sessions, information for parents around a lot of the issues that we've talked about. And Alan just triggered my thought about that very incredible grand rounds from just a few weeks ago.
And if I could add as well, Tony, specific resources for families, for children in general, probably the single best website out there is called healthychildren.org. It's maintained by the American Academy of Pediatrics. So it has up-to-date information on everything from what to do when my baby has the hiccups to what to do when my 6-year-old asks me where babies come from. And it's really practical, evidence-based advice about a whole range of questions. And so it's the go-to place for parents to start with any question about sex, drugs, rock and roll, a whole range of things. One other thing about children with autism in particular is they respond very well to social stories. And in general, using books and stories and websites can be very helpful. This is the kind of information you can get from CARD, I mentioned before, the Center for Autism and Related Disorders. And so very often they'll have specific tools that you can use to talk to your child, depending on his or her age, where there's a story and you read the story and you talk about it. And it's a very effective way of doing exactly what Dr. Delamater was talking about before.
Thank you, Dr. Brasco. Thank you, doctors. This hour has flown by. Dr. Flores, would you like to make some final comments before we say goodnight?
Yes, thank you very much, Tony. And I want to thank you specifically for your very skillful moderation. Many thanks to all of our viewers, as well as to my fellow outstanding panelists. And to our viewers, your attendance and your questions are vitally important to us. The importance of delivering timely and appropriate care to improve children's health and well-being cannot be understated, and I hope we've highlighted that tonight. At UHealth and the Miller School of Medicine, we appreciate this, and we do all we can to provide excellent care and advance the kind of research that responds to the needs of children we serve. What you heard tonight reflects the innovation, the passion, and commitment that are at the core of our mission. We're dedicated to giving children the opportunity to live healthy, meaningful lives and to train the next generation of healthcare providers and leaders who will focus on the well-being of children and their families. President John F. Kennedy once elegantly stated, "Children are the world's most valuable resource and its best hope for the future." Your generosity ensures the brightest of futures for our children as we continue to conduct pioneering research, deliver the very best treatment, and support outstanding physician scientists in the field of pediatrics. Our physicians and scientists could not do this without you. You inspire us to go above and beyond and find the solutions that will make a difference in the lives of children. And thank you so much for joining us tonight.
Dr. Flores, Drs. Armstrong, Polgaron, Brasco, Delamater, a remarkable hour. Thank you all so much. And thank all of you for participating in tonight's In the Know Town Hall. Again, I don't think we can stress enough how important tonight's topic is. It's a topic we need to be more open about, a topic we need to keep on top of mind, and a topic that moves us in a certain way to make a difference in the lives of these children and all of the families that are impacted. We have all the resources right here at the U. Let's make sure we take advantage of these great, and truly amazing and passionate doctors. Please remember that a full recording of this program will be posted online. Look for the link in the coming days. And in a moment, you're going to see a survey about tonight's town hall. It's going to come on your screen. Please take a minute to submit your feedback. I took that poll. It took me 30 seconds because what that's going to do is help us understand your interest and improve our program. As always, we wish you and your family good health. And always remember, it's all about the you. Good night, everyone. Thank you for being with us.